Africa has overtaken Asia as the continent with the highest levels of hunger. According to the latest UN report, 309 million people across Africa, about 1 in 5, faced hunger in 2025. So why is the crisis deepening, and what will it take to bend the hunger curve? Now, the UN says global hunger has in fact reduced in 2025. That's the third year in a row. But around 645 million people in the world still do not have enough to eat in 2025. Nearly half of the world's people living with hunger, 309 million, live in Africa. Last year, more than half of all Africans did not have enough food. 2 out of 3 could not afford a healthy meal, and the UN warns that if nothing changes, by 2030, more than half of the world's undernourished people will be in Africa. Food insecurity was worst in Central Africa, where 3 out of 4 people did not have enough food. In Eastern and Western Africa, that number was 62%. In Northern Africa, it was 31%, and Southern Africa had the lowest rate at 24%. 3 African countries, that's Nigeria, the Democratic Republic of the Congo, and Sudan, had the highest number of people facing severe hunger anywhere in the world. Nigeria's food crisis is getting worse because of conflict. In the north, children are becoming malnourished again at alarming rates. Aid workers say the Iran war has made food more expensive worldwide. Families already hit by violence can no longer afford basic food. Children are the worst affected, as Yunus Demiroglu reports.
The United Nations says more than half of Africa's population experienced moderate or severe food insecurity in 2025. In Nigeria, the continent's most populous nation, children are paying the highest price.
I'm not happy to see the number of women coming to the health facility with their malnourished children increasing. Since the beginning of 2026, many men who were once able to provide for their families have lost their jobs and can no longer do so. This is due to the high cost of living, driven in part by rising fuel prices.
For families already struggling with rising food prices, another global shock has made life even harder. The US war on Iran has disrupted energy markets, pushing fuel prices from 60 cents per liter in February to $1 in April, with a knock-on effect on food prices due to rising transportation costs. Shehu Aminu says rising costs have forced him out of his job as a driver. The income that once paid for meals, school fees, and everyday essentials disappeared, leaving him unable to provide for his family. His youngest child is now one of more than 6 million Nigerian children under 5 facing acute malnutrition, including 2 million with severe acute malnutrition, according to the Red Cross.
When I wake up every morning, it pains me to see my family because I can no longer provide for them the way I used to. Back then, $1.50 was enough to buy a nutritious meal for the family. Today, even over $3.50 cannot buy the same items. And the reality is, I cannot even afford the $3.50.
But the conflict in the Middle East is only part of the story. Currency reforms weakened the naira. The removal of fuel subsidies in 2023 had already driven up transport costs. Years of insurgency, banditry, and displacement across northern Nigeria have disrupted farming, reduced food production, and left millions dependent on humanitarian aid. The result is the country's worst hunger crisis in a decade. More than half of Nigeria's children suffering from acute malnutrition, and around half of the country's 36 million food insecure people live in the north. The World Bank says malnutrition contributes to around half of the country's roughly 500,000 child deaths each year. Aid agencies warn the crisis is still deepening. UNICEF says economic shocks are expected to push millions more children worldwide deeper into poverty, forcing families to spend more on food while cutting back on healthcare, nutrition, and education.
For children long term, what that means is they're more likely to be stunted, their development will be compromised, they are less likely to stay in school because their parents are under so much financial strain. So the long-term implications for children are absolutely terrible.
Nigeria's hunger crisis was years in the making, but aid agencies warn that new economic shocks are making recovery harder, putting more families at risk and leaving more children vulnerable to the lifelong effects of malnutrition. Yunus Demiroglu, Africa Matters.
Right, let's hear more from Dr. Maximo Torero, Chief Economist of the Food and Agriculture Organization, that's FAO, who joins us from Rome, Italy. Thank you very much, Dr. Maximo, for making the time for this conversation. So the United Nations says global hunger is falling. That's a good thing, sir. But Africa is moving in the opposite direction. Why is the continent being left behind?
So we need to understand first that the world is declining in terms of hunger numbers from 8.6% of prevalence in 2022 to 7.8% in 2025, so a reduction of 14 million people. The case of Africa, we have to look at it in two ways. In terms of prevalence, it's the first time in several years that Africa has declined its prevalence of hunger, moving from 20.3 to 20.0. But that's the percentage of the population that is in hunger right now. If we look at the absolute numbers, Africa has increased, as you correctly mentioned. And Africa has now surpassed India. We are now talking of 309 million people in hunger in Africa. And the reason behind this is first population growth. You have a population growth in sub-Saharan Africa of around 2.4% relative to 0.6% in the case of Asia. So that has increased the number of people in hunger. Plus, of course, the problem of conflicts, the problem of climate stress, and the debt stress that many of your countries are in this moment.
Right, and we'll talk more about that. You mentioned population growth and conflict, but you said it. Africa has surpassed Asia. It has overtaken Asia as the world's hungriest continent. I'm curious about what Asia did, or what has Asia done, and what can the African continent learn from Asia?
Yeah, so there are two continents which are improving. One is Asia, especially South Asia, and the second one is South America, Latin America, and the Caribbean. In the case of South Asia, especially is driven by India, which is the country that is doing the major amount of efforts to reduce hunger. And India has moved from a two-digit level of hunger to less than one-digit level of hunger in the last 4 years. So what they have done, and what also South America has done, I think there are two types of policies that are being implemented in these countries. One is related to social protection, well-targeted social protection programs that allow you to increase efficiency in targeting the poorest of the distribution, and also including school feeding programs, which are given access not only to starchy foods, but also to healthy diets to their own population. And the second package of programs is related to production and productivity. They are increasing the level of productivity in a sustainable way so that they can also have the supply of food and the diversity of food that is required to be able to provide to the local people and to be able to increase access to these minimum requirements of calories so they can move from hunger. So in conclusion, I think it's the two sets of policies at the same time, which is creating the important return that Africa can learn from in the following years so that we can start to accelerate that prevalence, which is starting to decline.
So then, based on what we're dealing with now, how can African leaders incorporate what you just said, what these two continents are doing to, or what they did to deal with their hunger situation, just to better the African, or the situation, or the system in the African continent, rather? Because again, I will refer to something you said earlier in an interview, which is in regards to the Strait of Hormuz. And you actually said that there are several risks that are associated with this. And if this continues, then we're probably looking at higher numbers in the coming years, or by 2030, I would say. So what practical steps can African leaders take just to, avert all this? It's a crisis.
No, it's an excellent question. And I think countries in sub-Saharan Africa needs to learn from countries in South Asia and Latin America. But they also need to learn from their own countries, because some countries in sub-Saharan Africa and in Africa are improving. For example, we have Senegal, which has cut the share of hunger from 15.8 to 5.3%. We have Togo that went down from 24.6 to 10.2%. Ghana, 11.1 to 6.4%. Cote d'Ivoire from 17.6 to 11.4%. Rwanda from 31.8 to 22.6%. Mozambique, 29.2 to 22.3%. Tanzania is also doing progress. So I think you have to learn from inside and you have to learn from outside.
Right, and I like that you started with the countries that we can emulate that are within the African continent. Senegal, Togo, that's encouraging. Dr. Maximo, these top three countries that are the top in the world, with the highest level of food insecurity. Nigeria, such huge population, the DRC, Sudan. I want to go back to the point you mentioned or you raised earlier on the population growth. I mean, does this have anything to do with the numbers we're seeing, particularly Nigeria, for instance? Is it because of the numbers? And I'd like you to tie that with, again, the reasons for these, the reasons driving the hunger, conflict, climate shocks, economic shocks, rising food prices. Which of these is having the biggest impact?
Look, can you imagine if Nigeria creates a transformation that is needed? This is the biggest populated country. The change in the hunger numbers in Africa will be substantial. But we need to resolve the conflict problem in the north, and we need to start doing investment and invest in productive projects. Nigeria has an enormous potential, has a super dynamic private sector. We need to create that change. Nigeria is the host of the biggest nitrogen fertilizer company in the whole region, the Dangote nitrogen fertilizer company. Most of those fertilizers are exported to South America, 19.8. Nigeria can supply to the whole Africa if we resolve the bottleneck problems that doesn't allow that to happen, which are related to trade, are related to transportation, to logistics, and to affordability by other countries. So the potential is enormous. It's just an issue of a political will to start to do the change, the transformation, and to attract those people that had to go to conflict because they don't have food to eat and because they are poor. The same applies to South Sudan, to Sudan. For example, in South Sudan, we have an amazing project on rice. It's a tropical country. We can scale that up enormously, and we can supply rice to many parts of Africa. But again, sometimes it's cheaper to import from South America than to import from the neighborhood country in Africa because of the NTBs, the non-tariff barriers. So a lot of potential in the country. That's why I'm saying, let's learn from your own countries. Let's accelerate what you have. Let's build your institutionality. Let's find a way through production, through productive projects, to eliminate conflicts. Food security helps to reduce the probability of a conflict, and that's what we need to keep pushing in Africa especially.
Again, I like that. A lot of potential in the continent. You talked about goodwill, and political will, and I have to ask this as the last question. Many African countries have fertile land, and they have a large farming population. So is Africa's food crisis mainly a production problem? Or is it weak policies that are simply preventing food from reaching the people? Because this continent is rich.
Your continent is rich, is not only rich in agriculture, it's rich in natural resources. And you see many big countries investing in your continent because of that reason. The issue, as we put in this report, is two big groups, what we call the hardware and what we call the software. The hardware is about infrastructure. And here is where Africa needs to be smart, and they need to design their own corridors. They need to build infrastructure where agriculture also has potential. Because if there is a space where you can increase growth enormously, it's in agriculture. So Africa is basically an organic country, uses very little fertilizers. The potential to increase yields is enormous. So I think if we overlap that, we resolve a problem, we gain complementarities, and we create markets. So the hardware problem is extremely important, and investment needs to be attracted, and investment plans needs to be in place. Then from Africa to request IFIs and the MDBs to invest in those plans, not in what they think it is, in the plans that you need, which are already in your CARAP framework and your agreements. The software part is about policies. And again, here, political will, of course, is important, but policies and the software of these policies needs to be properly aligned. Policies and support to agriculture needs to focus in diversifying diets. Policies in terms of trade need to accelerate and standardize food safety system in Africa. You can do that. You can have, like European Union, you can have a standardized food safety system so that people can move commodities across borders with a certification, an e-phyto certifier, a digital certifier. You can also create a passport for currencies to move money across the continent. So those are the types of software that you require to complement with the hardware. But I think the potential, as I said, is enormous, and you have a lot of space to grow.
Dr. Maximo Torero there, Chief Economist of the Food and Agriculture Organization. Thank you very much, sir, for your time and for such valuable contribution. Still to come on Africa Matters.
My name is Victoria Amunga in Kenya, and I'll show you how these healthcare workers are training to combat the spread of Ebola across East Africa.
The United States says it will end financial support for the African Union peacekeeping mission in Somalia by the end of this year. This has now added pressure to the country's security transition. As Somali forces prepare to take on greater responsibility, the government is strengthening military partnerships with allies, particularly Turkey. Mohammed Kahir reports from Mogadishu.
These newly trained Somali soldiers graduate from the Tuksam Military Academy in Mogadishu. They will soon be deployed to bases across the country as part of efforts to strengthen Somalia's security forces. The academy has trained thousands of Somali troops under defense cooperation signed with Turkey in 2017. Its role has become even more critical after Washington's announced that it will end funding for the African Union peacekeeping mission in Somalia at the end of 2026.
We recognize and deeply appreciate the tremendous efforts, hard work, sacrifices and courage demonstrated by my Turkish counterparts and his government in supporting Somalia across key sectors, including defense, security, the economy and diplomacy.
More than 10,000 African Union peacekeepers, mostly from the neighboring countries, are currently deployed in Somalia. They have been supporting government operations against the armed group Al-Shabaab while gradually handing over security responsibilities to Somali forces by 2029. The US government says it has provided security assistance worth about $3.6 billion to the mission since 2007, but not anymore.
Somalia does have limited options. This is in spite of what's happening globally, but there are some options. One would be finding bilateral support, similar to what AMISOM used to receive in the beginning. This is very difficult considering the global climate and the donor fatigue around that. Second would be to convince the US to change its policy. That's also a long shot, considering how consistent they have been on this.
Even though other partners like the European Union contributed about $88 million in April, Somalia is struggling to cover its own defense budget due to decades of economic challenges, as it faces growing threats from Al-Shabaab and Daesh in the northeast of the country.
There is no turning back. We will return to every location where we lost our commanders and soldiers. We must reclaim those areas. The plans are already in place and the operation is progressing.
But the future of the almost two-decade peacekeeping mission, without US funding and the United Nations logistical backbone come next year, is now in doubt. Analysts warn that sustaining military gains will depend on securing long-term funding, strengthening Somali security institutions, and maintaining support from international partners. Ahmed Kahir, Africa Matters, Mogadishu, Somalia.
Now, in Mogbalu, the epicenter of DRC's Ebola outbreak, miners are being forced to choose between risking infection or letting their families go hungry. The highly contagious Bundibugyo strain with no approved vaccine or treatment has spread through crowded pits where miners work cheek by jowl, as Hope Kirubi reports.
In this gold mine, necessity overweighs fear. Miners are working side by side in the mud, ignoring the deadly risks to feed their families. This mining hub is the epicenter of the DRC's 17th Ebola outbreak.
Ebola is devastating our livelihood as gold miners because getting our essential equipment has become incredibly expensive. Whenever an outbreak is reported, the roads are immediately blocked, leaving the supply vehicles completely stranded.
This economic hardship is making the health crisis even worse. Official data confirms the virus has infected thousands of people nationwide.
The entire municipality is now affected by this disease. On this specific street, we don't have confirmed cases yet, but in the surrounding areas, the situation is growing far more complicated.
Years of militia violence have left the region deeply distrustful of the authorities. with many of the 130,000 Mongwalu residents suspicious of the government, aid groups and healthcare workers, numerous infections go unreported, masking the true scale of the outbreak.
Everywhere you go in the neighbourhood, people are talking about Ebola. That is why I took my grandchildren and brought them deep into the forest. I'm keeping them here in the fresh air so they don't wander into crowded places.
With no vaccine or approved treatment for this rare strain of the Ebola virus, the death toll in the DRC keeps rising. Yet, driven by record-high global gold prices, the lucrative gold mining trade in Ituri province shows no sign of slowing down. Hope Kirubi, Africa Matters.
Now, as the Ebola outbreak spreads across the Democratic Republic of the Congo, Kenya is getting ready. The country is training healthcare workers to respond if the virus crosses the borders for the first time. Through realistic simulations, frontline staff are learning how to detect and respond to suspected Ebola cases. Victoria Amunga reports from Nairobi.
Inside a simulated emergency ward in Nairobi, healthcare workers attend to a mock patient displaying symptoms consistent with Ebola. Sis Ndiaga is among a dozen of them taking part in the exercise. He says the realistic scenarios have improved his readiness to respond to an Ebola outbreak while preventing infection.
I decided to participate in this training because it already seemed important to me. Every time there is a new epidemic, you find that there is always a lack of preparation. So, at times, we could be very complacent and all that.
Kenya has never recorded a case of Ebola, so participants practice identifying suspected cases, managing isolation wards and safely handling infectious materials while wearing full protective gear. These skills are critical to limiting the spread of disease.
We are targeting doctors, clinical officers, nurses, and lab people. We are also targeting people working in water, sanitation, and hygiene.
The exercise brings together healthcare workers from different disciplines, helping them prepare for a real outbreak.
We are reinforcing a lot all the prevention, control infection, all the measures for infection control. The one that are systematic in all the medical activities, but the one that are specific for Ebola, how to protect themselves, how to take care of the patient.
The preparations come as a controversial US-funded Ebola isolation facility for American citizens in the country triggered protest over risks to public health, prompting a Kenyan court to suspend its construction.
Recent outbreaks of Ebola and other infectious diseases across Africa continues to expose gaps in health systems. They underscore the importance of not just preparedness, but early detection and rapid response. But equally important is community awareness. This is critical in detection and prevention of future outbreaks that could save hundreds of lives.
While there is no outbreak in Kenya, government officials say they're taking measures to reduce the risk of cross-border spread.
We heighten our surveillance activities so that now, instead of just randomly picking patients, travelers to be able to check, we now scrutinize everybody who is coming in so that we can be able to pick maybe those who have elevated temperatures and things like that.
Organizers say at least 1,000 healthcare workers have completed the training. The outbreak may be simulated, but the lessons are real and could be used to respond quickly if Ebola reaches the country. Victoria Amunga, Africa Matters, Nairobi, Kenya.
Finally, most athletes usually retire in their 30s, but in rural Kenya, some are only just getting started. A group of Kenyan grandmothers are turning to football, not for the trophies, but to stay healthy, as Rumesa Choda reports.
For these grandmothers in Makueni, retirement means kicking life into high gear. Dressed in their football kits, they head to the pitch twice a week.
This group was formed as a necessity for those of us who have retired and they are leading fairly idle lives and having a lot of challenges with our bodies. So we came together to kick for health.
The Mayani Grannies Football Club brings together women between the ages of 50 and 80. Many joined after struggling with health issues. Now, instead of spending their days alone, they spend them training and preparing for local tournaments.
I wasn't feeling well because I had high blood pressure, but since I started playing soccer, I'm doing well. I don't have any health problems. I can walk far, and I hope I will live longer.
Experts say stories like hers are backed by science. Regular physical activity lowers the risk of heart disease, diabetes, and obesity, while improving balance, flexibility, and muscle strength.
It also improves one's mental health because of the production of the endorphin hormone that we call it a happy hormone. And that's with aging, one is able to manage any form of stress because they are active.
According to the UN, Africa is one of the world's fastest aging regions, with the number of people over 60 expected to more than triple by 2050. But policies to support healthy aging have struggled to keep pace. But these grandmothers hope to set the pace and represent Kenya in global competitions while encouraging older people to stay active and healthy. Rumesa Chodar, Africa Matters.
That's our show this week. What did you think of Africa's hunger crisis? How can African governments and the international community bend the hunger curve? Share your thoughts on our Africa Matters YouTube page or on X. From me, Grace Korea Kanja. Goodbye.